He wasn't even born yet. But his future was already written in his DNA. A silent mutation. A cruel twist in the code. Doctors knew he would live, but with constant pain. Until one scan changed everything. Not just his life, but an entire family's destiny. You're watching Tech Science Insights, where tomorrow's tech meets today's truth. If you're passionate about the future of science, humanity, and innovation, consider subscribing. It means a lot to us and helps keep the knowledge flowing. What are pre-birth DNA scanners? Imagine a world where doctors can scan an unborn child's DNA and detect hundreds of genetic diseases before the child takes their first breath. No surgeries, no risk, just data. This isn't science fiction anymore. Using advanced whole genome sequencing, AI, and nanotech, scientists can now analyze fetal DNA from a mother's blood sample to identify dangerous mutations linked to disorders like X-Tay-Sachs, X cystic fibrosis, CHI, sickle cell anemia, Huntington's disease, C muscular dystrophy, and even predict risks for future conditions like cancer or early onset dementia. These scanners don't change the baby, they reveal hidden dangers and give parents and doctors a head start to prepare, treat, or even prevent suffering. How does the technology work? The process begins with a small blood sample from the mother. Inside that sample are teeny fragments of the baby's DNA. Advanced AI systems reconstruct the baby's full genome faster than ever before. Then, machine learning algorithms scan the genome for mutations, compare it to vast medical databases, and predict the chances of disease development. The AI doesn't just look for existing illnesses. It can simulate how the genes might behave over time. It can see what the naked eye, and even expert doctors, can't. Real-life use cases and global progress. In the UAE, DNA scanners are being introduced in marriage counseling to help couples understand shared genetic risks before starting a family. This isn't just medicine, it's preventive compassion. The ethics. Where do we draw the line? But here's the question. Just because we can scan everything, should we? Ethically, this is where things get sensitive. What if parents choose to abort a baby because of a predicted disease that may never actually manifest? What happens if governments begin enforcing DNA scans and make decisions force the parents? What if corporations get access to genetic data and use it for insurance or marketing? And most of all, are we moving towards designer babies, choosing eye color, height, or intelligence? That's not the purpose of this technology. It's Islamically appropriate, and ethical use is to reduce suffering, not to play God, as long as the intention is preservation of health, life, and dignity. This scanning can be a mercy, beach tea, not manipulation. Helpful possibilities for humanity. Used responsibly, DNA scanners can help in amazing ways. Prepare families emotionally and financially for special needs children. Start early treatments, even before birth. Prevent inherited disease chains across generations. Support genetic counseling for couples. Bradders a Daved Anavase, Spectality, and house practice with anonymous ethical data. Imagine an entire generation's born healthiers. Not because of editing, but because of awareness. But the danger still exists. Without strong ethical boundaries, this can lead to genetic discrimination in schools, jobs, insurance. Social pressure to eliminate imperfect children. Privacy invasion at the DNA level. Unwanted psychological burdens on parents. Black market gene editing using DNA data. So we must ask, who owns your DNA? And who decides what life is worth being born? From an Islamic perspective, life is sacred, and only Allah knows the full future of any soul. If a disease can be prevented without harming the child, and the technology is used to lessen suffering, then scholars generally consider it as permissible. But using this tech to judge the worth of a life, or to interfere with the natural creation process for vanity, is clearly discouraged, even sinful. Ethics and intention are everything. Future possibilities. This is only a prediction. By 2035, we might see home-based DNA scanning kits for expectant parents, the real-time gene therapies during pregnancy, government-subsidized genome scans in developing countries, and possibly even AI nannies are trained on your baby's genetics. But with that power comes responsibility and risk. One scan, one glimpse into what could be. Not to judge, but to protect. Not to change destiny, but to ease the path ahead. The future of birth isn't about perfection. It's about compassion, prevention, and preparedness. This is Tech Science Insights, where we explore technology with heart and with humanity. Subscribe for more truth-driven tech.